Okay, one thing I wanted to show today is it may be a little loud with the birds and the background noise from the cars, but I wanted to show when you're working with BMT patients, you want to try to keep anything that has vomit or feces from diarrhea in a separate bag, and you're going to want to spray that as soon as you can. If you need to rinse it off a little and then spray it, because some of those stains are really hard to get out. This particular one has up to 7 days where you can wash out from dried stains. So I spray it and try to get to the laundromat about every 7 days. In the back of my car, I keep a box that just has refills of the materials that I need for doing laundry. So I have the Myers laundry soap, and that's all natural plant-based, and I'll talk about that later. But with BMT patients, they can get what is called graft versus host disease, and one of the key factors of that is a rash. So I eliminated as much as possible cleansing materials that could possibly give him a rash, because your skin does change when you have cancer. It gets very dry. One thing though I did keep in my box here is, of course, your all value bleach, just your typical bleach, because you're going to need that for the whites for the underwear. There's just probably no way around it if your person you're caring for gets mucositis, which is very gross and messy. But as long as you wear gloves and you take certain precautions, you're going to be fine. I just keep this in the back, in my trunk of the car, and it has it's just an extra box that I had just to keep things stable from rolling around in the trunk. Then I have a go bag for my laundry. A lot of people know go bags as survival kits. Well, this is my laundry survival kit, and I break all the other stuff down into smaller containers. So the first thing I have here is a Lysol, laundry Lysol, and you just need to put a little bit in with each load that you're doing, because remember, you want to kill any bacteria that could hurt the patient. And you know, at the hospital is the #1 leading place for bacteria, unfortunately, even though we take a lot of precautions. So I just transferred, this is a leftover bottle that I had from my Lysol, so I don't have the original bottle to show you. This is my bleach bottle. Again, I'm not using anything but stuff that I would typically have from just my everyday to keep the bleach in, just little containers of water bottles. This is a little mini Myers container that I really like. This is how I first started trying these materials. But if you turn it, you can see it has the fluid ounces on the side, and that's one thing that I really liked. So I could just measure, as I'm dumping down in, I just kind of measure 1 load per ounce, and that makes things nice and fresh. And you know, with BMT patients, their sense of smell changes, and they can become very sensitive to a lot of smells, which leads me to my next point. I just had typical dryer sheets. These were on sale, Bounce. However, I have found I am going to go and get the Myers or another natural plant-based dryer sheets, because these actually, the odor is just too strong. It smells great, but it's just too strong. So I'm going to go switch that. So other than that, I just use in the trunk of the car. You're going to see it's a mess, but this is the life of caring for BMT patients. I've got everything just in one big laundry basket here, and this is how I throw everything in the trunk, and I take it to do laundry. And I'm actually at the Ronald McDonald House, and I will show you, there's a wonderful park here to walk to the side. So if you want to go for a walk, I don't know if you can see it, but way down here at the end you see the Ronald McDonald sitting on the his little stand down there so the kids can come up and sit beside him from that, and that's really a lot of fun. But I come here because it's actually free for patients and caregivers to come do their laundry. And I figure, you know, this is just one little thing that I'm doing to save money. You know, I've heard a lot of horror stories where people actually lose a lot in their income and can lose their home and everything from the expenses of going through a catastrophic medical crisis like we're going through. And so I just wanted to share that information, and maybe some of this will help you. Remember, keep gloves, extra gloves if you can, just little disposable ones. You can pick them up at most grocery stores, Walmart, or even just grab a couple extra when you're at the hospital and throw them in your purse so you have them. And then I'll give you a lesson on how to take those on and off later, but I just wanted to share this for you for right now. Have a great day.